This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. This morning, our guests are Andrea Dusenberry and Barb Manier. Andrea, good morning.
Good morning. How are you?
I'm doing great. And Barbara, good morning.
Good morning.
I appreciate you guys taking some time. Of course, October is Breast Cancer Awareness Month, and Mon Health Breast Cancer Center is having a campaign this year, a breast cancer campaign, Detect It, Treat It, Defeat It. We'll be talking about the Detect It part of that this morning. But before we jump in, you guys will have to talk about yourselves for at least a minute or two this morning. Andrea, your name starts with A. That comes to the start of the alphabet, so you can go first. Tell us about yourself. Where'd you grow up? Where are you from? Where'd you go to school? How'd you end up with Mon Health?
So I am born and raised in Morgantown, close to Preston County. Decided after I graduated from Morgantown High that I was going to WVU to get a degree in finance. I graduated and decided that after sitting through those classes that in an office was not the setting for me. I wanted to take care of patients, so I ended up going back to school to be an x-ray tech, and I worked for 13 years at a facility, and 3 years ago I made the jump and went to Mon Health, and I could not be happier since doing that. The small town community feel of the hospital is what really, truly drew me to Mon Health. Patients are still patients. They're not a number. And the teamwork, environment, and culture that is in Mon Health is why I love my job.
And Barbara, same to you. Tell us about yourself.
I'm a Preston County girl. I grew up here. I live here now. When I graduated from high school, I went straight to WVU for the Rad Tech program. Worked 29 years in another facility, and 7 years ago, I decided to make the jump up. A job came open here at Preston Memorial, which was much closer for me, less of a drive, and I was really attracted to the community support, being part of your community. Being able to go out. This is a really busy month for us. We do a lot with breast cancer awareness with the local schools and the local community. So that's just really important to me at this point in my career.
And Barbara, you're at Preston Memorial, is that correct?
I'm at Preston Memorial, and Andrea's at Mon Health Medical Center.
All right, and Andrea's at Well, we want to make sure people know so they can say hello when they stop by to see you. Because
absolutely,
that does happen, I'm told.
It does.
All right.
We like that part.
Awesome. Well, as I mentioned, October is Breast Cancer Awareness Month, and we're talking about detecting breast cancer. So, Andrea, can you share what are some of the early signs of breast cancer?
So some of the early symptoms are, and the most common is that new lump or mass. And even though most of them are not cancerous, if you do detect a new lump or mass, it is important to get that checked out immediately. Some of the other symptoms include swelling, nipple pain, discharge, and really anything that you notice that is not normal for yourself. Most of the time, though, there really are no signs or symptoms or with that physical exam. So that's why it's kind of important to make sure that you do your annual screening mammogram.
And we'll get to the importance of the annual mammogram here in just a minute. But, Barb, are there steps you can take before the mammogram on a regular basis to keep an eye or detect what Andrew was talking about, those lumps or abnormalities?
It's really important that every woman do self-breast exam every month so that you get used to what your breasts feel like and what may be a change for you. Also, to collaborate with your primary care provider so that they can also do breast exams and they can kind of guide you through the process.
All right, and that brings us, of course, to the annual mammogram, which is obviously a very important part. Andrea, walk us through a mammogram appointment, if you will.
So your annual screening mammogram appointment, the patients are going to come to the hospital. They will check in with our registration. When you check in with registration, they're going to give you a form to fill out, an annual screening mammogram form. It is very important that you fill that form out accurately so that the techs kind of know what they're looking for when they bring you back for your mammogram. The techs will bring you back to the room. They'll have you change. They'll go over that screening form with you, and then they'll take you in to do your screening mammogram.
And Barb, the mammogram, is it as bad as the stories that I've heard?
Absolutely not. Andrea and I were just talking about that a few minutes ago. We think a lot of people, we know a lot of people shy away from even having screening or coming to have it done because of the horror stories that they've heard. And we really encourage people to come in. Our techs will work with you. We'll get you through the study. And honestly, most people say when they're done, this was not as bad as what I had it built up in my head.
I can firsthand say that is true.
Hey, but before we take the first break, Andrea, when should women start having yearly mammograms done?
Women should start having their yearly mammograms done at the age of 40.
And before that, is it a matter of family history or kind of consultation with your primary care physician about your risk?
Family history, or if you do detect something that's abnormal.
Our guests this morning, Andrea Dusenberry and Barb Manier. We are talking about Breast Cancer Awareness Month, the Detect It, Treat It, Defeat It campaign. We're talking about detecting breast cancer this morning. We'll continue that conversation. We got to squeeze in a quick break first. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Andrea Dusenberry, Barb Manier. We're talking about detecting breast cancer. It's part of the Mon Health Detect It, Treat It, Defeat It campaign. October is Breast Cancer Awareness Month. And Barb, does Mon Health offer 3D mammograms?
Yes, we do. We offer 3D mammograms across all of our facilities.
So how are those different, better than the traditional mammogram?
Traditional mammogram only was typically 4 images. With a 3D mammogram, I like to explain it to people kind of along the lines of like a CAT scan or CT. It literally takes slices through your breast so that we can see, most importantly, through that dense breast tissue that a lot of women have. It can kind of break it apart, and we can see if there's anything hiding in there.
And Andrea, how quickly can you get the results back from a 3D mammogram?
With all of our mammogram studies, patients usually have their results the same day.
Oh, wow. That quick, huh?
Yes.
Can you give us a ballpark? How long did it used to take? Was it 24 hours, same day? That sounds like a quick turnaround.
I think that primarily as long as I've been in the field, it's usually been within 24 to 48 hours.
We're talking to Andrea Dusenberry, Barb Manier. It is Breast Cancer Awareness Month. Detect It is what we're talking about today. Barb, are there any lifestyle changes, healthy habits that you can adopt and address that actually helps decrease the chances of breast cancer?
That is one of those things that's also very important for you to work closely with your primary care provider so that they can guide you through what is right for you.
And Andrea, how much does family history and, whether your mother, your sister, cousin, whatever the case may be, how much does that factor into your risk for breast cancer?
Family history is probably one of the biggest risk factors that you're going to have as a woman. And I think that is something that it is very important for you to discuss with your PCP, your family doctor, your gynecologist, and kind of make sure that they are aware that you do have that family history.
I'm going to put you guys on the spot. I'll toss it to both of you because I don't know if you have the numbers or not. Do you have numbers on how likely women are to be affected by breast cancer?
Yes, we do. And this is specifically talking, all women have a 1 in 8 chance of developing breast cancer in their lifetime. Some numbers specifically for West Virginia women, and these numbers came from the American Cancer Society. In 2023, it's estimated that 1,620 West Virginia women will be diagnosed with breast cancer. Approximately 230 will die from the disease. The encouraging thing that we have saw over the last year is the number of women being diagnosed has went up, but the number of women dying has went down. So that's exactly what we're trying to do. We're trying to detect early so that we can save lives.
And I was about to ask that question, that the number of women dying going down, that seems to me to say that more are detecting it early because they're doing the self-examinations, they're getting their yearly mammograms. And I've learned a couple of things doing this show over the years. One of them is if you can detect something early, including breast cancer, it's much more treatable, and your prognosis is much better if you catch it early. Is that fair to say?
Yes, that is correct.
Andrea Dusenberry, Barb Manier joining us. We're talking about detecting breast cancer. Not to jump into the next segment or the next show too early, but let's say a patient gets their yearly mammogram done, something shows up that doesn't look right. That's a technical medical term, right? Doesn't look right. What's the next step in the process at that point?
The next step in the process is usually a biopsy. We try at the medical center to have patients from abnormal biopsy or abnormal mammogram to biopsy within 7 to 10 days. So we try to get them in. It also sometimes includes advanced imaging. So the patient may have a breast MRI to look more closely at that suspicious area.
One thing we want to make sure that women understand, though, is when you come in for your screening mammogram, we may call you back to come back for just additional mammo views or an ultrasound before that biopsy. And we don't want women to panic at that point, because most of those are completely fine once we do that, and we don't have to move on to that next step. But it's scary, and we understand that.
Yeah, I wanted to ask about that before we go to the break. And you guys talked about the patients are people; they're not numbers. Getting that call that, hey, we need you to come back, that can be very scary. That can be a very anxious moment for patients. So I don't know. I guess my question is, how do you handle that, or how do you try to just work with the patients, understanding that this can be a very scary process if you don't get the you're completely fine result?
Well, number one, I think is to me, the most important thing is to get them back in as soon as possible, so that they don't have to worry as long and they have answers quickly. Our techs are also really good at educating people and having a calming presence and being able to get them through that process.
Now, does that make how much of a difference does that make, being able to provide that information? Because maybe the scariest part, is it not knowing? Is it the uncertainty is really what is the scariest part?
I think for all patients that the uncertainty is the scary part. I mean, especially if you wait or we can't get them back in. A lot of times for those additional images, we get the patient back in that same day that we call. We can get them in same day or the next day. So I think that kind of helps, ease their mind a little bit. But it's really, truly the uncertainty.
Andrea Dusenberry, Barb Manier joining us this morning. We're talking about detecting breast cancer. October is Breast Cancer Awareness Month. We'll continue the conversation in just a moment. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Andrea Dusenberry, Barbara Manier, our guest this morning on Mon Health Talk. Breast Cancer Awareness Month here in the month of October. Mon Health's Detect It, Treat It, Defeat It campaign. We're talking about detecting breast cancer this morning. And this question is for each of you. No cheating. You each have to have your own answer. All right. You ready for this? Here we go. What is something people should know that they may not already know about breast cancer or breast cancer detection? Andrea, you get the first shot at it.
I was going to throw that one right to Barb.
Well played, Andrea. Well played. All right, Barbara, you're on the spot.
Well, I think we kind of already touched on it a little bit. Like, I would like for people to know that this is really not as bad as some of the horror stories that you hear. Like, it is important. It's important for you to come in. We have some wonderful mammographers who will work with you and walk you through the process. So it's just really important. And, please don't be scared.
Andrea, anything to add?
Just to kind of add to what Barb said, starting your screening mammograms at the age of 40 is very important. I just know firsthand that sometimes you have to kind of start before you're 40. So the techs that we have at all facilities across the system are incredible. They are compassionate. They will walk you through the entire process. So truly, there is nothing to be afraid of.
How do you schedule a mammogram? Is that something you do with your primary care physician, your OB? Can a patient just call you guys? How do you set one up?
Absolutely. You can just call any of our facilities and get it set up. You can also visit monhealth.com/mammogram to schedule online. Probably the easiest way is to call us.
Okay, but you don't necessarily need a referral. You can just call up and say, hey, I need to have this done, correct?
You do need a physician referral in order to have a mammogram done. But if you do not have a primary care provider and you need help finding one, we will be glad to help you get that set up also.
It's also been my experience on the show, women are much better about having their primary care physician in order than most guys are. A lot of times, you guys know, you're laughing, but that's right. That a lot of guys are like, I went to the doctor when I was in high school. Nonetheless, I digress. We got about a minute left. What's the one thing you want folks to take away from the program today, Andrea?
The importance of your screening mammograms and detecting anything that is abnormal before it becomes a serious issue.
And Barb, one thing you want folks to take away?
If we find it early, it's treatable and it can be taken care of. So please come get your mammoth.
Andrea Dusenberry, Barb Manier, our guest this morning. October is Breast Cancer Awareness Month. Detect it, treat it, defeat it is the campaign this month. Obviously, we'll be talking about treating it coming up on next week's show. Guys, thank you so much for the time. I appreciate it. Thank you.
All right. Thank you.